Good evening, everyone, and thank you so much for joining us during our Women's Health Summit. Whether you have been here with us all day or just now joining us, we really do appreciate you being here. My name is Asia Bailey. I'll be your co-host and moderator for Your Skin is Beautiful panel, where we will be covering a variety of hair and skin topics, especially for Black women.
Sorry about that. Hello, everyone. My name is Jade Curtis. I will be your other co-host and moderator for this evening. Hello, Dr. Banga. Thank you for joining us here. You didn't miss too much just yet.
Sorry for the delay.
Yeah, no problem. So we were just doing our quick introduction. So a major theme for Black women, especially over the past decade, is really loving the skin that you're in. So from hashtag Black Girl Magic to sayings like "Girl, your melanin is popping." Black women have really been the leaders in women truly embracing our natural beauty. And, we've just been falling deeper and deeper in love with all shades of brown and all textures of hair. But during this self-love journey, we want to make sure that we're giving ourselves the correct care for our specific skin types and hair types from head to, well, down there as well. And, who better to inform us of these than these two amazing doctors, Dermatologist Dr. Brooke Jackson and OBGYN Dr. Cecilia Banja. Thank you so much for joining us, ladies.
Thanks for having us.
Of course. So on this journey to healthy, glowing skin, many women have begun seeking professional dermatologic care for their skin. So I guess this is a question for Dr. Brooke. What are some questions that Black women should ask a provider to ensure that they're receiving, proper care from their provider?
Yes, let's first talk about that word provider. Here's the thing. There's actually a long history behind the terminology provider, but most physicians find it insulting, actually. We didn't go to provider school. We went to medical school. And the word provider is really intended and put forth by insurance companies to confuse the public, quite frankly. Because when you hear the word provider, you don't know who you're seeing, what their credentials are. It could be a nurse, it could be a physician assistant, it could be a physician. Who knows? And so when you ask how to find out who you're seeing, that's the question you should really ask is, what is your licensure? Okay, because you're either licensed as a nurse, you're licensed as a physician assistant, or you're licensed as a doctor, a physician. But the word provider, there's no way to be able to tell what the education is. And there is a difference. And this is absolutely no disrespect on any of these professions. We work together as a team, but there's different training and different experiences and years and years and years that provide the different levels of education.
Absolutely. Thank you for correcting us on that.
So I guess we should just get right into it. So how do we find the right dermatologist as Black women?
So there is a website, which I don't know if I put something in the chat, will everyone see that, or I don't know how that works. But there's a website, the American Academy of Dermatology, and it is www.aad.org. I'll put that in the chat. And that is where every board certified dermatologist is found. And so there, as with any profession, there are people who call themselves dermatologists that are not. There are people who call themselves dermatologists that aren't even doctors. And so, first and foremost, do your research. So you can go to aad.org and look for anyone. You put in your zip code and it'll come up with all of the doctors that are in that zip code that are board certified dermatologists. There are other resources, blackdoctor.org for sure. You can connect through this organization. You can ask around. Typically, your primary care doctor will know who the doctors are in the area. You can go to the local medical society. And so there are lots of local opportunities to figure out who is in your area.
Awesome. Nice. So I noticed, over the past maybe 5 or so years, there's been a lot of different people trying to assist people on their skincare journey, whether it's, an esthetician or, unless someone wants to go to a dermatologist. When do you recommend that someone visits a dermatologist versus, an esthetician who's doing, facials and, dermabrasions and all things like that?
Yeah, it kind of depends on what it is that you're after, right? So, as a dermatologist, we diagnose and treat conditions of the skin, hair, and nails. Estheticians provide services. In my mind, an esthetician is sort of like a massage therapist of the skin, right? So it's a feel good opportunity. A lot of people for self-care for sure, but not to diagnose and treat skin conditions. Often we work together, and just about every service that an esthetician provides, a dermatologist invented. And so they do work hand in hand to make you look better.
Okay. Well, with all those things that are going on, what are some red flags or questions that we should be asking for these services when it comes to estheticians and dermatologists?
What is your training? First and foremost, and no one should be ashamed to tell you what their licensure is or how they've been trained. And if they can't say that, or if it's not easily accessible, most people have a website or social media, and there's a link to their bio or something like that. And so that really should be readily accessible. Probably every week I see a patient who thinks they've seen a dermatologist, and, they end up in my office and we have to undo some things. And they never saw a dermatologist. And so, it's important, I think, to make sure that you do your research, whether that is contacting your insurance company to find out who is in your plan, whether that is going, all of this resources that I mentioned earlier, to make sure that you are going to someone who is licensed and capable of providing treatment to you.
Gotcha. Okay. Interesting. So whether someone does decide to, I guess, visit a dermatologist or esthetician, or even if they decide not to and they feel they can do their skincare on their own, when should they start to be concerned about different changes to their skin? Or is there a certain time that they maybe should consider starting to see a dermatologist or a professional?
Yeah. I just saw 2 patients today who, they bring in their bags and bags of stuff that they have either found out about on YouTube or Google, and it just wasn't right for them. So they've wasted hundreds and hundreds of dollars on products that were not going to help them achieve what they wanted. And so again, as a dermatologist, we handle anything related to hair, skin, and nails. Just like if you have a heart problem, you would go to a cardiologist. You wouldn't sort of muck around and, research your heart disease on Google. So we just sort of cut to the chase, and we can save you time and money because this is what we do all day, every day. And we can direct the treatment plan for you. And so, when is the right time to go? You certainly do what you have at home or do what you want to try. And if things aren't getting better, depending on what it is, probably in about 4 to 6 weeks, it's probably time to make an appointment.
Wow. So that quickly.
Yeah.
I didn't realize that. I'm one of those people who kind of does the at-home treatments or sees something on TikTok and says, hey, I want to try that. But it's interesting.
No, that is interesting, because I was just going to say, how do you monitor the different changes that goes on with your skin? And how do you know when it's a problem or when it's just your body's just changing? Because I do have a friend, she got a mole and she's freaking out. She doesn't know whether it's cancer or if it's a beauty mole. So how do you know?
It's a great question. And, I always tell my patients, there's never a question that is a wrong question, right? If you have a question, ask it. I don't ever want somebody sitting at home trying to figure out or trying to self-diagnose. That's not fair. And, I went to school for almost 18 years to do what I do. And so a lot of times patients will say, well, how can you do that so quickly? I'm like, it took me 18 years to be able to do it this quickly. Right. And so As far as moles, there's a lot of subtleties that we learn in our dermatology training, say, oh, that's good, that's bad. Almost always patients who come in and think one particular mole is bad, that one's fine. It's the one they didn't think was bad, that's the problem. So that's what we do all day, every day. And so, if there's a question, ask it, make an appointment. I always prefer to tell people and pat them on the shoulder and say everything's fine. You don't have to worry about it, than to have somebody who's been sitting at home for months and months and months thinking that it was fine and it wasn't. And so there's never a bad question. There's never a wrong question.
So what are some self-checks you can do?
Yeah. So if you go to AAD.org, that's the American Academy of Dermatology, there is a whole section there for patients. And this May, we're coming to the end of Skin Cancer Awareness Month. And so there's a lot of information about how to do a skin check, about what to look for. We call it the ABCDs of moles. And A means asymmetry. So ideally, if you have a mole, you put a line down the middle. The two sides should equal. So if they don't, they're asymmetrical. B stands for borders. And so if you were to take a pencil and draw a circle all the way around the mole, it should be sort of an intact round circle. So you don't want irregular borders. C is color. So even though you may have moles that are of different colors within one mole, we don't really want too many colors. Okay, so you want kind of one color, consistent. D is diameter. So anything which is larger than a pencil eraser, which is about 6 millimeters, 4 to 5 millimeters, which is kind of difficult because things have to start somewhere. So I wouldn't wait until something gets larger than a pencil eraser. And E stands for evolving or evolution. So something that is changing. We all know our body, and it's good to get to know your body. Take a look in the mirror once a month. If you do your breast exam, which Dr. Benga can talk about, you should know what the growths are on your body. And if things are changing, like this wasn't there a month ago, or this, is getting bigger or bleeding, if it's not healing up in a reasonable amount of time, which unless you're picking at it or rubbing it or doing something, most things should heal up. If you think it's a bug bite or a pimple, should heal up probably within about a week or two. If it's been a month or it got healed and then it becomes unhealed, that's something to look at. And so, at the end of the day, it's anything that makes you uncomfortable, right? If you have a sense this isn't right or this changes and I'm not sure about this, those are all reasons to have it looked at.
Okay. So I feel like we've directed all the questions towards Dr. Brooke. Dr. Benga, I feel like as we're aging as women, or just as we get older, we can notice some changes down there to our skin as well. Or is there ever a time that we should be concerned? Or I guess kind of a similar question. Are there exams that we can do, or are there any changes that maybe we should be concerned about down there? When should we see someone about our changes?
Okay. Well, I was learning along with Dr. Brooke talking, so I was just as engrossed in what she was saying as you guys were. And I'll probably take just 2 steps back as well and just fill in a little bit on what she started off talking about, which was making sure that you're seeing the right provider. So just to expand on that a little bit, there are 2 types of physicians in the United States. So you have your MDs and you have your DOs. And those are the 2 types of physicians that have gone through medical school training in the United States. There are, I'm a DO, and I get a lot of people coming in and they'll ask me, so what exactly is a DO? And I have no problem at all explaining that to them. As she stated, anyone that has done the right amount of training should have no problem or should not feel offended if a patient asks what the training is, especially if they don't know. So I totally agree with Dr. Brooke that you should, first of all, make sure that you're seeing the right provider. I'm sorry, right physician, right physician for your problem. And sometimes that problem might be something that somebody has to be a physician to diagnose, and other times maybe you can get away with something else. But if it's a problem that requires a physician, please don't get fooled into seeing somebody else that's not as well trained to take care of that. So now back to your actual question. With the two different types of physician training in the United States, specifically when it comes to the OBGYN training, there are two specific medical boards that sort of govern all the care that we provide. So there's the ACOG and there's the ACOOG. And with the OOG, the extra O stands for osteopathic. A lot of our guidelines and criteria do come from the ACOG, although ACOOG also has a lot, and the two work collaboratively as well. The ACOG recommendations are that usually between the age of 13 and 15, young ladies should see a OBGYN. Now, that seems kind of counterintuitive to a lot of parents sometimes because they're still used to seeing their pediatricians around that age. And there are a lot of pediatricians who are well trained and comfortable talking to young ladies about their changes that they're going through. But there's nothing wrong with seeing an OBGYN that early as well. That's about the age where most young ladies have started having their periods and they've started transitioning from childhood into adulthood. And some of those questions, are answered best by people who just do that on a daily basis. So so as early as 13 to 15, you can see an OBGYN. It doesn't have to involve a vaginal exam. And I have no problem saying that word, and I hope nobody cringes by hearing me say that word. It is a part of our body, and we should be very comfortable saying it and not calling it by weird names. It's a vagina. So, so as early as 13 to 15, you can see an OBGYN. It won't necessarily require a vaginal exam. It could be just to talk about the periods, just to talk about what the expectations are when the body changes start happening, and just to even go over anatomy, which, as Dr. Brooke said, this is something I love talking about, just having people get comfortable with their bodies. So I hope that answered your question.
Absolutely.
Okay.
I also had a question for you, just because just like we were asking Dr. Brooke, what are some things that we should be aware of, like moles on our skin? We're young ladies, we're out there dating. How can we tell the difference between like an ingrown hair down there and something seriously wrong?
Okay.
How can we do those self-checks?
Well, it starts from knowing what's normal for you. We all have subtle little changes with our bodies that are not exactly the same as other people. I'll use the breast for an example. Some people have inverted nipples. Some people have normal extroverted nipples. But if you have an external nipple and it turns internal, you should know what your baseline was so that you can bring that up to your doctor. Same thing when you start shaving. Depending on the products that you use and how sensitive your skin is, you may start developing ingrown hairs and things like that. At any point in time, there's nothing wrong with coming to see an OBGYN and asking what the difference is, especially if you're not sure. There should be no embarrassment at all about just coming in, just for reassurance. And even if you do come in and something is found to be an infection that you developed through interaction with somebody else, coming in sooner rather than later is always best, because as always, if we intervene early enough, we can prevent some further complications from happening. So it all starts with knowing what your body looks like at its baseline. And you can't do that without looking at your body. So take a mirror, look down at the vaginal area. Look at what we have these idealized pictures in books of what the vagina looks like. Not everybody's vaginas look like that. Some people have longer labia, majora, or longer labia minora. Some people have flatter ones. Some people have darker pigments on their labia than others. But if you never look down there, you'll have no idea what's normal for you. And then when other things show up, you won't know whether it's abnormal or not. So I guess the long and short of it is know what your baseline is. Examine your body. As your body start going through changes, look at them. And if you have any questions at all, you come and you see us and we can tell you whether this is something you should be concerned about or something you shouldn't.
Okay. So some of the changes that we see are just kind of a part of aging, right? So maybe we get some fine lines, or maybe we're noticing some things starting to hang a little lower than they used to, or whatever the case may be. So, and I feel like we're, as women, constantly in a battle to prevent it or reverse it, which I know we should embrace it, but I know a lot of us we don't want to end that battle just yet. So are there healthy ways to prevent or to reverse these changes that happen as you begin to age? Either Dr. Benga or Dr. Brooke.
I'll let Dr. Brooke start with this one.
I'll take a first stab at that. And so we start aging as soon as we're born.
Absolutely.
And so I give a lot of talks about aging and skin changes. And, if you go, not in a weird way, but go and stare at people who are in their teens and their 20s and their 30s and their 40s and older, or if you have family members, just kind of line them all up and look at them. And so typically most people, children, big, juicy, fat faces. That's why babies look so cute. 10, 12 years old still, but usually in the late teens, early 20s, things start to lean out. And there's like that shift from the baby look into the, oh my God, that's like a big kid and a young adult. In the 20s, late 20s, early 30s, we actually start making less collagen. Collagen is what supports our skin and supports our blood vessels. And typically after about the age of 30, we are making about a tablespoon less a year, right? And so by the age of 40, that'd be 10 tablespoons. And just to equate that with some other things, a tablespoon for those people, and I know there are people out there who have had fillers, that is 1 syringe of filler. Okay. So that is why this, and what does collagen do? Collagen helps to support our skin. It is really the foundational support. And so people spend a lot of time on, let me make sure that my fine lines and wrinkles, and I get it, but there's a different, you have to kind of think of the structure. So if you think of your skin really as almost being the tablecloth on your dining room table, we want to iron it out, make sure there's no wrinkles, make sure there's no stains or discoloration. But you can have the prettiest tablecloth, but if the table is dented, it's not going to look right. Right? So that's why we have to kind of start from the inside and work up. So in our 40s, we start losing some bone mass. So a lot of people think osteoporosis is only for the larger bones. It's for all of your bones. And so if you look at somebody like in their 60s or 70s, one of the reasons that their like front is sort of receded back and the lips sort of hang over is you're having some bone resorption. The bone is like your dining room table. And then on top of that, we drape the skin. And so if the bone is starting to resorb, our skin, our tablecloth becomes too big, and that's the sagging. So, one of the worst things you could ever do for your skin and your overall health is to smoke. It affects your cardiovascular health. It affects your blood flow. Blood is really what circulates nutrients to every single organ in your body. And so that is the absolute worst thing you could ever do for your health. And if you're smoking, please stop. Next thing is, a little bit of alcohol is fine. Better to choose wine than other things because there's actually some health benefit to red wine. It's got something called resveratrol, which is anti-aging antioxidant. I am a big proponent on following a plant-based diet versus a lot of processed sugar and processed food. There are several movies that I chronically recommend to my patients about transitioning more into plant-based. And that is, those are all on Netflix. It's Game Changers, What the Health, and Forks Over Knives. And that's kind of a nice way to understand the importance of getting rid of meat and processed food and dairy. Dairy is, as far as skin concerns, awful for your skin. So it's highly inflammatory, and just about every disease process, not just in dermatology, but in life, heart disease, arthritis, it's all rooted in inflammation. And so if we can put our bodies in less of an inflammatory state, food as medicine, in this country, we like to more medication, prescription. But there are a lot of things that we can do that can put ourselves in a better position to manage our genetic gifts or curses. So, exercise, getting good health, getting good sleep, all those things we know we're supposed to be doing, self-care, giving yourself a digital diet, getting away from the screens, going outside, being happy, hanging out with your friends, going to church, praying, all that stuff that we know we're supposed to be doing, but we don't do.
Well, I guess my thing is, when do you start using these age-defying products? Because I'm nervous, okay?
Yeah.
I see lines coming in right here.
So I forgot. People will often ask, like, what is the best product to use? And I will always start with sunscreen. Sunscreen is the best anti-aging product you could ever use. So use it. Okay. I've been wearing sunscreen since I was 14 years old. I had no idea what I was doing, but I started wearing it because I decided to start wearing makeup. And there was no makeup that was my color, because at that time, product companies only had 6 colors, and I wasn't one of those 6. And so I found a product made by Clinique, which was called City Block, and it was sunblock. I had no idea what I was doing. And so I've been wearing sunblock since I was 14 years old. But
as foundation, I'm sorry, as foundation?
Yeah, because it was tinted. It was tinted, right? So I'm like, I had no idea, but I found it.
Wow.
So, making sure that if you do nothing else, start wearing sunscreen. And especially with brown folks, people believe you don't need it. While it is true that we age much more gracefully, it still happens. And so, again, I saw 2 brown patients today. They're both parents. Their kids are in sports. So they're out on the track field and out on the soccer field for hours every weekend. No sunscreen. That catches up. And a lot of times brown people also have other conditions like high blood pressure and diabetes, and they're taking medications to manage those. Those medications make you more sun sensitive. And so once we start getting some of those issues, then the bigger issue is hyperpigmentation. That's actually the number 1 issue of complaints with brown skin. But we have to take care of what caused it. And so that's when we get back to your earlier question about how long do I wait to go see your dermatologist? Well, if you have acne that is not well controlled, we know that you're going to end up with hyperpigmentation. Then you're going to be focused on the hyperpigmentation. We got to fix the acne first. So, it all kind of comes together. But I would start with sunscreen. In your 20s, you may want to start with a retinol, which is easy if you already have acne, because a lot of acne medications can contain retinols or retinoids. I always tell patients that a retinoid is like a deposit in your skin's 401k. So you're not going to see the benefit today, tomorrow, next week, but you will be grateful when you're 40 if you started using your retinols in your 20s. So, they're prescription strengths for acne patients. They're over the counter that most people can get. So I would most definitely start with that. And sunscreen. Retinoids should always be used at night. They will make you more sun sensitive. And so you put that on at night. You use your sunscreen every morning. And that's a great place to start. You don't need, I've never been a fan of toners, ever. I'm not a huge fan of gritty cleansers. Why? Because what is the problem with brown skin? You don't want to irritate brown skin, because if you irritate brown skin, you're going to get what? Hyperpigmentation. Right. So a lot of people feel that brown skin is tough. It is actually not. It's some of the more sensitive skin out there. So less is actually more. You want to be careful, and this is no disrespect on grandma, but cocoa butter, shea butter on the face. So when my acne patients come in and I say, what are you using? And they give me this list of stuff. I'm like, okay, let's just go back to basics. You have acne and you're putting butter on your face.
Yeah.
Why are we doing that? So sometimes we get in our own way.
Uh-huh.
But, if you're 10 or you're 3, and, I tell my patients, especially if you've got a lot of kids and you got to moisturize them, and, brown children are very well moisturized. So get a big jar of whatever. Crisco is fine for, little kids. As soon as they can read, they don't want the Crisco on their skin anymore. But as soon as you hit adolescence, different products for the face and for the body. Like if you're 10 years old and you want to use Vaseline from head to toe, go for it. But once those hormones kick in and you become acne prone, you're getting ready to start your period, that's when you really start needing to separate and use facial products and body products. But I would stop with all of the oily, shea butter, all that stuff on the face. If you have acne, if you don't have acne, if it ain't broke, don't fix it. That's fine. Grandma will be happy. But if you're in my office with a face full of acne and you insist on using shea butter on your face, we got to have another conversation.
Well, you would have my grandma upset because she used to wipe me down with the cocoa butter every morning.
And all.
Okay, if you say so.
I love cocoa butter. It smells good. I used to eat it when I was a kid. It's really good.
Oh.
Okay. I was gonna say, Doctor, where were you a few weeks ago when I got sunburned? I had blisters all up and down my back because I thought Black people didn't get sunburned. I never wore sunscreen ever in my life.
I'll share this story. I am originally from Ghana, West Africa, and I grew up in Ghana, West Africa until I was 20. And guess what? 5 years ago, I started getting sun blisters. Yeah, I went to Dr. Brooke, but yes, Black people can get sunburned, and we can get sun poison and sun allergy and hypersensitivity and everything as well. And the only thing that works right now is if I go out in the sun, I have to use sunscreen every 2 to 3 hours. So I have to reapply it pretty frequently, and then I don't get burned.
So
don't let the cloudy days fool you. Okay?
Sorry?
Don't let the cloudy days fool you.
Mm-hmm.
Yeah. Sun can penetrate, the UV rays can penetrate right through clouds. And so every single day, I mean, just make it a habit, just like you brush your teeth in the morning, put your sunscreen on, done. You don't have to think about it. You're done.
So when it comes to sunscreens and, now that Black people are starting to accept the fact that we need sunscreen, which one should we get, like with all the different SPFs, and like, which one should we go for?
Yeah, so the best sunscreen is the one that you will use, and different things for different seasons, right? So I am a runner, just wrote a book later. But if you're outdoors and you're doing some athletic endeavors where you may be sweating heavily, that will be a different sunscreen from the one that you put on this morning before you go to work, right?
Wow.
So for women, it's usually pretty easy. Moisturizer with sunscreen. There are lots of options available. Some of the over-the-counter products that I like that tend to do very well with brown skin. There is Aveeno Positively Radiant. That tends to go pretty well with just about every skin tone. There's another one called Mele, M-E-L-E, which also does very, very well with brown skin. It's called Mele for short for melanin. Both of those are drugstore brands. If you are going to, I'm in North Carolina, it's getting hot, it's humid, those lotions may be a little too heavy if you're going to go out and work out. And then if it's too heavy, your skin is going to feel occluded and you're going to start breaking out. And so for athletic endeavors, I prefer to sport products. So typically those are a little bit lighter. Even if they're sprays, you can still use a spray, just don't spray your face. Spray your hands, and then you can do that. Okay. But the most important thing is to make sure you put on enough. Most people fail to do that. And so if you're going to go outside on a summer day in t-shirts and a short, you need to use a shot glass. And we all know what that is, full of sunscreen. That is a full ounce. Most people do not put on that much. And if you go and you look on your counter at your tube or bottle of sunscreen, most of those bottles are about 8 or 12 ounces. That means if you're going to go to the beach and you are putting on a full ounce of sunscreen and you are reapplying it every 2 to 3 hours, that bottle should be empty by the end of the weekend. And if you have not done that, you did not get that SPF 50 that you think you had, because that is what was tested in the lab to garner the rating of SPF 30 or 50, a full ounce, reapplied every 2 to 3 hours. So if you only put on a little bit, like, look, I use sunscreen, then you probably have like an SPF 5. You don't have an SPF 50, okay? The reapplication is crucial. And so there are 2 different types of sunscreens. There is a physical sunscreen and there is a chemical sunscreen. They work differently. So physical sunscreens typically have or contain zinc oxide, titanium dioxide. In the olden days, that's what the lifeguards used when they had like the little white stuff on their nose. Now the product is micronized, and so it's more elegant, meaning that we don't have that white. Some of them still do, but it's easier to rub in. Those physical blockers act by physically blocking the sun rays from getting to your skin. Okay. The chemical sunscreens are more like sponges. So they absorb the UV radiation. And so the best sunscreens contain both. So we're absorbing and blocking. Now, the challenge with brown skin is the Smurf look, right? It's all chalky. And so, for a variety of reasons, there's some people who just don't want to or can't use chemicals. Because if you have more sensitive skin, a chemical sunscreen is one that's more likely to irritate your skin. And so when somebody comes in and says, I can't use sunscreen, I break out all the time, sometimes it's just too heavy, but sometimes it may be the chemical that's bothering you. And so if you have super sensitive skin, you're probably better off choosing a sunscreen that is just a physical zinc oxide, titanium dioxide. And I will tell you, this is one of the reasons that women generally tend to have fewer skin cancers on their face and certainly on their lips, because a lot of makeups contain zinc and titanium. So we're already getting a little bit of sun protection in our makeup, especially with lipstick, matte lipstick. Always go for the matte, never the gloss. So if you, the trick with sunblocks or zinc and titanium is to get a tinted one, because the tint is going to dial it down a little bit and make it a little easier for brown skin to blend for the product to blend so you don't look like a Smurf.
Okay. So quick question, because I'm taking notes over here. So when it comes to sunscreen, you're saying I can get any sunscreen and I can put it on both my face and body, or do I need a separate sunscreen, one for my face and another one for my body?
Yeah, great question. And so marketers, I don't know if anybody's in marketing, marketers know that women will spend more money on their face than they will on their body.
Sure will.
So that is why facial products are small quantities and more expensive. So are you going to buy your facial sunscreen that you paid more for and use it on your body? I wouldn't. I'll go to Walmart and get whatever's on sale for the sunscreen, use it on my body. I think there's plenty of good products over the counter. Most people spend their money on their face, right? So what I will also say is when you put it on your face, do not neglect your neck and your chest. Most women take great care of their face and they stop there. And so if you look at everyone's wardrobe, everything in a woman's wardrobe is open. So make sure you bring your sunscreen really down to the top of your bra so that you get all of this, because I have a lot of patients fast forward into your 30, depending on how rough a life you live, smoking, drinking, going to the beach, all that kind of stuff. You'll be a little wrinkly in the chest. And so you want to make sure that as you age, your face matches the rest of your body. Like, how many Hollywood folks do you look at? Like, face looks great. What's going on down there?
That was a really good question, Asia. So going back to, the products that you use and, just the different things that we put on our faces, do we need to make a change to which products we use depending on the season, or is that just kind of a myth? Like, can we use the same thing year round, or do I need to change it for spring, summer, winter, fall?
Yeah, it depends where you live. So I lived in Chicago for a long time, and the weather there is very, very drastic. I mean, it's very humid and hot in the summer, just like it is here in North Carolina. But winters are a whole different ballgame. And so, you have to, just as you change your wardrobe, I tell patients to change their products. You don't need 4 different seasons. I mean, most people, it's mostly 2.5 seasons, right? So this time of year, when the humidity kicks in, most people actually need less moisturizer because humidity, your skin makes more moisture, makes more oil in the summertime. But in the wintertime, when the heat goes on in the house, you start wearing the coats, you need to heavy it up a little bit. And so it doesn't have to be dramatic, but you will notice your skin's a little bit drier. You need to make sure you got a humidifier in your home. You need to heavy up your moisturizer. You maybe need to back off your retinoid. So kind of depending on and what else you're doing. If you're a swimmer, that's a whole other conversation. So kind of taking into consideration what else you're doing in life. And the other time you need to change your products is usually every time there's a 0 behind your birthday. Okay, so about every 10 years, the products that you were using in your 20s, hormones are starting to shift a little bit. And Dr. Banga can tell us when that happens. But every time you have a 0, your skin is getting drier, 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 drier. And so, particularly in perimenopause and menopause in this country, I think the average age is 52, then most people will notice a shift late 40s, 50s, depending on, what happens in your family, or if it's a surgical menopause or something else has happened, you're going to need to change your products to accommodate that.
Okay. So going from just, our seasonal care for our face, let's talk about the care that we need when it comes to making sure that everything down below is just right when it comes to waxing, threading, laser. Because I know myself, I shave, but I want to get into things like laser. So what are the appropriate treatments? Like, when do you know, like, you're okay with doing just shaving or a wax or a laser? Like, how do you know? How do you know what treatment you should try?
It really boils down to the type of skin you have. And sometimes if you don't try it, you don't know. So there's nothing wrong with trying different methods to see which one your skin is more responsive to. As Dr. Brooke mentioned, your skin goes through changes as you age. And I get a lot of people that'll come in and say, I started breaking out now and that didn't happen before. Well, you're now 40 and you started doing that when you were 20. There are going to be some changes. We
Right.
do have hormonal changes that happen with age, and your skin gets either more sensitive or less sensitive with age as well. So there's nothing wrong with trying different methods. Now, if you tried waxing, in the same way that you have to make sure that you're going to the right physician to take care of your needs, make sure that whoever you're going to do your lasering or your waxing or your threading is also appropriately credentialed. Look up reviews, find somebody else that has been there before. You can get skin burns from somebody applying overly hot wax to your skin. You can get, skin damage if the person is not rightly trained. So make sure that you're researching the facility and the person that's providing the care. And there's nothing wrong with trying different ones. I believe that you can try different things. I have people who are sensitive to hair removal um, um, lotions. And so they just absolutely cannot use that. And you wouldn't know that unless you tried it. But if you tried it once and your skin did not like it, listen to your skin and just don't use that again. When it comes to lasers, I'll probably leave that to Dr. Brooke to address. But there's nothing wrong with threading. There's nothing wrong with waxing. There's nothing wrong with shaving. Do realize, though, that there is a cultural aspect to it, and there is a personal preference to it. My recommendation, if you're going to do any of that, is try not to take every single blade of hair off. There's a reason why hair is in the locations that it's in. Hair, especially in the vaginal area, sometimes serves as a barrier and a filter to keep the bad things out. And so if you take everything off, some people will find that they will end up being a little more prone to bacterial or yeast infections because there's nothing there to filter out, the sensitive skin on the vaginal vault rubbing against clothes, especially when people are wearing all these tight fitting clothes that have no ability for air to aerate the area. Your body's pH is going to change. You might be a little more prone to some overgrowth of your normal bacterial yeast. So yeah, don't take everything off if possible. Yes, leave a landing strip if you need to. Um, but you certainly can try different products and see how they work. But with regards to the laser, I'll leave that for Dr. Brooke.
Yes. I love laser. I did a laser fellowship up at Harvard. And I actually did the studies that allow us to use lasers in brown skin. So that's kind of my world. With that said, it's not for everybody. And there's a lot of myth out there about lasers as well. I will tell you the most common area that I laser on women is right here. There's no woman that wants to walk around with a beard. And so that was one of my original studies. And I still do the treatment myself for a couple reasons. Most of my patients that come to me have brown skin. Brown skin is tricky. And so you do have to make sure that you know who is doing the treatment and what their credentials are and that they're capable. It is easy enough to point a laser at somebody and push go. What you need to be able to understand is the laser tissue interaction and what to look for and how to manage complications. And so that's really, if you don't know how to manage complication, you shouldn't be doing the treatment. And with brown skin, you know, especially with laser, the myth is that it's permanent. There's no such thing as permanent hair removal. What we are doing is we're miniaturizing the hair follicle. Now, is it life-changing? Sure. I have women who have been getting up every morning, shaving their face, running to the bathroom, hiding from their husbands. We do the laser treatment and it gives them their life back. They don't have to do that anymore. Now you have to maintain it because we're not killing your hair follicle. We're miniaturizing it. And so most treatments are, you know, depending on which area, face, armpits, probably bikini, those are the most common areas that I treat. I typically tell people we're doing a treatment phase and a maintenance phase. So your treatment phase is probably 3 to 5 sessions every 3 to 4 weeks. And then your maintenance will probably be once a quarter. Will you still have to do a little something there? Sure. But is it going to be to the extent that you're doing it right now? No. And so why would I suggest that too? Because people do get ingrowns, they get discoloration, they get irritation. And so they're worried about all of that. And in order to do it, we have to take care of what the problem is. And if they're having a problem shaving, this will change their life. You know, there's nothing wrong with shaving. There's nothing wrong with waxing or threading. You know, as Dr. Benga said, you have to kind of pick your poison and choose how you want to manage it. And I have some patients who do both, right? So some people will do a couple laser treatments really to kind of debulk. And then they might do a little shaving or waxing if they're getting ready to go on vacation or go to the beach or something when they just kind of want to clean up.
Nice. That's interesting. I'm personally a waxer. That's probably an overshare, but I've definitely considered laser and I've just kind of been concerned about it. But that information was actually really, really helpful. I didn't know it was, I don't know, so welcomed, I guess, to brown skinned girls. I don't know why I thought it wasn't. I don't know if someone told me that, but
Now you have to be very, 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 very careful. I cannot tell you how many complications I've seen from other places.
Really?
So not everybody has the lasers that are appropriate. And just because you have the laser doesn't mean you know how to use it.
Mm-hmm.
And so, you know, I would definitely do your research on that part.
Okay.
But it is safe in brown skin and has been. The laser technology, the original lasers for laser hair removal have been out probably since about 1998, but they were not safe in brown skin until about 2004. Mm-hmm. And so been around for a while. And, you know, again, doesn't mean that every place has the proper laser, because not all lasers are created equal.
Right. There's
different wavelengths. And the wavelength of laser that we use for brown skin is typically 1064, which is called a YAG laser. And so that is one question you want to ask. Do you have a YAG laser? But even if you have a YAG laser, you got to know how to use it.
Because I know you mentioned that if it's the wrong laser, it can cause discoloration and, you know, scarring and things like that, which kind of brings me to something that a lot of Black women are dealing with as well, which is hyperpigmentation, right? And so I know that's a big thing for Black women. And so I'm just kind of curious, kind of transitioning over. So how can hyperpigmentation be prevented, whether it's from lasering or hair removal or whatever the case may be? Can hyperpigmentation be prevented for Black women?
Yeah, I mean, so the proper term is called either post-inflammatory hyper or hypopigmentation. And brown skin can do either. So hyper means darkening, hypo means lightening. And the post-inflammatory part of it is crucial because that means there's something that caused inflammation. And I always tell people that brown skin, again, is very, very sensitive. Those same cells that make you brown, that make black don't crack, that going to make you age very, very gracefully, those same cells are very, very, very sensitive. And if you irritate them in any way, whether it's because you took some cookies out of the oven and like hit the oven, you fell down and scraped your knee, or you shaved, or a bug bit you, you're going to get a little dark mark. Sometimes people will get a little light mark. And the issue is not, let me just get rid of this dark mark. The issue is addressing what caused it, because you are never going to get rid of it. For example, if you've got acne or folliculitis or, eczema, you will never get in front of that hyperpigmentation until you get the problem under control. And so a lot of people just want to focus on the external sort of cosmetic component. And, personally, I don't ever offer anybody any hyperpigmentation treatment until we take care of the problem. Like, here's the carrot, I'm gonna dangle it, but you're gonna have to do this first. And if you can't do this, we're not doing that. Because it's going to be a waste of time. If we don't fix your acne, you're still breaking out, you're never going to get better. And you're just circling. So, just trust the process.
I'm going to piggyback on that. I especially counsel my young patients who start breaking out with acne. And yes, we do also have adults that break out with acne. If they have melanated skin, I do highly recommend that they see a dermatologist who is well trained in taking care of melanated skin, specifically for that reason, the post-inflammatory response that their skin can have, because especially when they're younger, because you don't want them to have these marks that they're going to live, their life with. So I see a question in the box here as well that says, does the menstrual cycle have an impact on the skin? So I'm going to quickly address that. It absolutely does. There are hormone fluctuations that happen and that cause us to have our cycles. The two main hormones that tend to regulate our cycles are estrogen and progesterone. There are small amounts of testosterone and even some steroid components to it as well. But specifically with estrogen and progesterone, they do ebb and wane during the menstrual cycle. And some people are a little more sensitive to either the estrogen component or the progesterone component. So just like people can have some bloating and some mood disorders and things like that in certain parts of their cycle, your skin can also respond to the estrogen fluctuations as well. So some people will find that they're a little more acne prone just prior to their cycles or when they're on their cycles. And so there's definitely a correlation there. And sometimes we have to find the right products to use at the right time in our cycles as well to help that. Hydration helps a lot. Eating well helps a lot. I find that a lot of people just before their cycle starts, because there's so much progestin that's released at that time, they do get that lethargic sort of, and then the cravings that happen, and they tend to go for the more unhealthy foods. And that can also exacerbate some of the skin responses that you'll notice. So it does help to keep hydrated and to continue to eat healthy every day, really. All right. I hope that answered that question.
It does. So there's a correlation in hyperpigmentation and breakouts with your menstrual cycle. Does that also occur during pregnancy and changes in your skin, like hair loss? Can you guys shed some light on that?
Yes, that can certainly happen. All the different trimesters of pregnancy come with their own different responses. In the first trimester, especially when you first get pregnant, that same hormone that I just mentioned, progesterone, tends to be the main hormone that is produced by the ovaries to grow the developing fetus. And so those symptoms that people tend to get just before their period starts, when progesterone is released to shed the lining of the uterus, it sort of gets exacerbated. So you'll find people having that bloated, fatigued, blah feeling. Sometimes they'll have some cravings. And that can also affect the skin, because if you're not having the incentive to eat certain healthy foods, and you start craving foods that are not necessarily kind to your skin, you might find that you start having some breakouts there. And especially if you're sensitive to progestins, you can do that as well. We know that there are some natural changes that the skin will go through all through the course of pregnancy. So especially in melanated folks, we will get some darkening of the skin in the facial area. We do get that linea nigra, that line that runs down along the belly. I do get people that get darkening of the skin around the breasts. And some people get to be a little more acne prone as well. So there are changes that will happen all through the phases of the pregnancy related to the hormone fluctuations as well. A lot of times these subside in the postpartum period. Unfortunately, some of the changes will become permanent. I had a patient just this week who asked me about the skin darkening on her lips. And unfortunately, for that is another thing that does happen. It can happen in the strangest of places. But our bodies are quite amazing things, and they respond beautifully. I just find all of this to be quite fascinating and interesting. And I do encourage people to sort of embrace this. I know you said it was hard to before, but I think it's quite magical, all the different things our body is capable of going through and experiencing and withstanding. And it's just really all beautiful.
Yeah, absolutely. I totally
Couldn't
agree.
agree more.
Well, I want to thank you guys so much for being a part of our panel today. We want to thank blackdoctor.org for for allowing us to host on their platform, as well as allowing us to be a part of the Women's Health Summit today. So I hope everyone enjoyed this summit, whether you only tuned in for this amazing panel with our amazing guests or have been with us all day. Again, we thank you so much. So thank you again, doctors. Thank you, Asia, for co-hosting with me. Thank you, myself, for putting this together. I'm just kidding. But thank you once again. And thank you all for tuning in. Hopefully we'll see you soon.
Thank you so much.
Take care.
Of course.
All of you.
All right.